This as researchers at the University of Washington are releasing a grim new projection. Their model estimates the United States could see nearly 500,000 deaths by February. That is, if states ease more restrictions. That's the red line you see there shooting north. It's the worst case scenario, 500,000 Americans dead. But if 95% of us will wear our masks all the time, the model shows deaths could be much less. You see that clearly from the yellow line down there at the bottom. Right now, the researchers predict we're on track to hit more than 385,000 deaths by February. That's the orange line there in the middle. For context, let's bring in Dr. Ali Mokdad. He's one of the researchers behind the model, a professor of health metric sciences at the University of Washington. Doctor, thank you.
My pleasure.
That line, it's horrifying. How do you come up with those numbers, and how realistic do you believe that is?
We're looking at the data right now, and we're looking at the relationship between these variables, such as mask and mobility, and of course testing. And we know from what we have seen in the Southern Hemisphere that the cases increased in winter, even with all the measures they put in place. So COVID-19 is seasonal, is following pneumonia seasonality, and unfortunately in December and January we'll see a rise in cases and in deaths.
The first time this hit us, we didn't really know it was here, I guess, and it exploded, and we went to a height, and we shut down. So it flattened for a while, and then we went to another height, and we shut down largely. This time, no signs of shutdown coming. I wonder if that gives you great pause.
It does. And unfortunately, we don't want to put on the table a complete shutdown. We want to give a chance for public health and for people to help each other by wearing a mask in order not to overwhelm our hospitals and our ICUs.
If you were talking to people about their upcoming plans and the way they're conducting their lives now, kids need to be in school, and in some areas that's been deemed safe, and that makes sense. But this idea of eating inside at restaurants and going to weddings and that sort of thing, how do you explain to people the seriousness of all of this?
It's a deadly virus. All of us are susceptible, and we're moving into winter where all our activities will move into indoor. So we need to be very careful as we move forward, and we need to change our behaviors and give science and scientists a chance to find a vaccine and a drug for this COVID-19, for the virus. So meanwhile, what we can do is wear your mask, watch your distance, wash your hands, basic public health and basic prevention in order to get out of it with less damage as possible.
Shepard Smith here. Thanks for watching CNBC on YouTube.